Hi, Paul Slackus, Good News Broadcast, speaking to Dr. James Kirchner. Hi, Doctor. How are you?
I'm doing great. Thanks, Paul.
Good. Doctor of Optometry and American Optometric Association, eye health expert, and but it seems like that 1 in 4 Americans have not visited an eye doctor, and that America's failing in eye, EYE-Q, okay? So that's probably not good news, because it's probably a good thing if you have the ability to see, to be able to see, right?
Absolutely. That was the number one finding in this year's survey. This third year we've done this American IQ survey, and surveying the knowledge of the public dealing with a wide range of issues with vision and eye health care. And number one is that Americans, despite the fact that eyesight's their most important, they say sense and ability, we're still, as a society, extremely lax about having that regular examination that is so vital to ensuring that we have long-term quality care, eye health, and vision.
Why do you think people are that way, or that are not putting it as a priority?
Paul, I think intentions are good, even though they know it's their most important to them. In society, we're so busy, and one thing with vision is that if we're seeing well, it's kind of like we put it to the back burner because we think that everything's fine, but that's not necessarily true. With eye diseases that I deal with every single day, most eye diseases are slow to develop. They don't have a lot of symptoms in the early stages, and so we can be fooled into thinking that everything's fine just because we see well. And so you kind of put the examinations to the back burner, and that's a wrong strategy.
Now, it's wrong because it can get worse, and it could possibly get better?
Exactly. It's going to get worse. If you have a developing eye disease or a vision condition, time doesn't generally make things better with eye health and vision. Time generally will cause the situation to continue to get worse, and we want to catch things as early as we can so we can treat disease and correct vision anomalies so that a person can have a healthier lifestyle.
Tell us about American Optometric Association, AOA.org. I'm looking at the website.
Yeah, American Optometric Association of 35,000 members of eye doctors around the country.
Okay. What is a para-optometrics?
Para-optometric is the designation for the technicians that work with the doctors. We have nurses in para-optometrics that work day in day with the doctor. In the clinics.
All righty. So give us is there something that all right, I'm looking at a monitor, I'm looking at you, and if I take my glasses off, then I'm not going to see this monitor. Okay, any tricks that we should know that might be helpful? So let's talk monitor world right now.
Sure. Boy, and you brought up, we call it computer vision syndrome.
Okay.
And it is a huge problem in this country. So many Americans sit in front of those computer screens all day long, and there's a lot of symptoms that develop. Tired eyes, fatigue, dry eyes, which is a gigantic problem. It doesn't sound like a big deal, but if you're suffering from dry eyes, it is a big deal. It's so uncomfortable. And I think headaches. I think people tend to just sort of say, they pass it off onto other things. I'm tense, I'm nervous, whatever. I'm not getting my sleep. But it's probably related to your vision and your eyes working so hard at the computer screen. We don't blink as much when we look at computer screens, so that leads to the dry eye syndrome. So there's a lot of things that we notice and we can treat. You may need lenses, like you just said. You have lenses that help you with that computer range. Getting away from that screen every once in a while and walking around and letting your eyes relax, blink a couple times. Wonderful over-the-counter lubricating drops in today's world that really can make things more comfortable and help you at your job. Very important.
Are there some common misconceptions?
Well, the biggest one that we found from the survey is that Americans still seem to think that carrots are the number one food to be eating, and we do know. And scientific research is showing that nutrition and exercise is so important for, of course, your total health, but especially for eye health. But the carrot thing is probably a misconception. We do know now that foods that are high in antioxidants, especially the green leafy vegetables, are so important to the health of our eyes. And so, that's a big misconception. We need to be moving in and thinking about green leafy vegetables and foods that are high in antioxidants.
Okay, and some people put them on their eyes, cucumbers.
I've heard that.
It's not too leafy, but it's supposedly it has some kind of property. Is that so? What do you think?
I think they're trying to help with wrinkles, tell you the truth. So,
and if they're hungry, then they also have something going.
Well,
fun facts. Is there a fun fact you want?
That's right.
Fun fact you want to share with us?
Well, I just would encourage people to have their eyes examined. You know, in the last 2 years, over 25% of the population's not even had their eyes checked in a 2-year period. So I'm going to encourage people to seriously put that on their schedule and get those eye examinations made.
Fantastic. Okay, doctor, thank you very much for sharing good news with us.
Thank you, Paul.
Take care.
Bye-bye.
Bye-bye.